Hi everyone. Hi everyone. Thank you for attending our virtual dental shadower session today. We want to remind you that in order to get your hours, you will have to take a short quiz, and as long as you get all three questions correct, you will earn your hour credit. The quiz link will be located in our link tree, which is in our Instagram bio. Okay, let's get started. We are very fortunate to have Dr. Meera for today's session. I'm handing you the mic. Feel free to start whenever you want.
Okay, great. Thank you, guys. Okay, so thanks everyone for joining me for another presentation from Dental Shadowers. As she said, my name's Dr. Meera, and I'm so excited to be here with you guys and share some of my experiences. I hope it will be of some use to some students or prospective students out there. So unlike some of the previous presentations, I'm not going to go through any clinical cases with you because I think you'll go through enough of those at dental school. You have so much time to learn all of that. So instead, I'm just going to highlight some of the things that you might not come across during your work experience, work shadowing, share some advice about things I had learned as I go through dentistry, and just talk about things that I wish I had known as a student. Okay, so let's get started. So a little bit about me to start. So I'm a general dentist based in London, England. I qualified from King's College London, which is in London, not that long ago. And following that, I completed my VT year. So in England, we have a system which is a little different to in the States or maybe Canada. We have to do this compulsory VT year, which is basically like a training year. So it's like the transition year from being a student to being a full-time practicing dentist. And it means that you have to work 5 days a week in a clinic, and you have a senior dentist who is assigned to you to be your mentor and supervisor, and they'll schedule once weekly tutorials with you and discuss any topics that you have, any tricky cases, difficult patients. They'll sometimes sit in with you once weekly to see a patient that you might be struggling with or with a treatment that you're struggling with. So it's a really great experience to learn lots of skills. And this is the year where dentists tend to pick up a lot of their skills and a lot of their confidence. So by the year, they're usually much more confident to be able to handle most basic things by themselves. Well, that's the idea anyway. So after that, I was working in a busy mixed general practice, which was mostly NHS. So again, we have a different system here. We have the NHS system and private system. So the NHS system covers mostly everything, fillings, root canals, dentures, removing teeth, gum treatment. But we also have private dentistry, which is where you'll find people doing more aesthetic work or specialists, or sometimes they're just using a different standard of materials to us. So obviously it's up to the patient where they want to go, and it might depend on the type of treatment that they need. There's obviously a big cost difference between the two. Private is a lot more expensive, but the NHS system does cover what the patient needs in terms of, just maintaining their oral health. But for things like complex cases or aesthetic work, they might go to a private clinic or, to a hospital, depending on what it is. Okay, so to start off, just some general advice for pre-dental students, because this is something I get asked about a lot. So this is just going to be a bit of general advice. So the first thing is, people always ask me why I went into dentistry, and looking back, actually, I don't think that my answer is a particularly well thought out one, but I also think that's quite common for a lot of dentists. Like a lot of people, I was really young when I made the decision. So here we don't do pre-clinical years. We just go straight into the degree that we choose. So at age 17, I had to decide basically what I wanted to do with the rest of my life, which was really difficult at that time. I didn't really have a clue about what I wanted to do, and I think I just chose dentistry based on my interests. I really like sciences, I really like the arts, anything creative. I like working with my hands. So I thought dentistry was a good mix, and I think a lot of dentists pick dentistry for that reason. They're usually scientific, also have a creative side, so I think that's a really common reason. But aside from that, I really didn't know too much more about dentistry. I wish I had a more realistic insight, I think, at that point into what, a normal day-to-day job was like, or sort of the ups and downs of the job. But things like virtual dental shadowers didn't exist when I applied to dental school years ago. So everything I had learned, I basically learned from friends or what I had read online or what I had been told by sort of careers advisors at school. It wasn't really a lot of information. And I think I only really found out what dentistry was like as I went through it, as I went through dental school and as I started doing the job, which isn't really the ideal way to do it, I think. So on that note, the best advice that I can give to a pre-dental student considering dentistry would be just to get a really good idea of what it would be like. It's a different experience for everyone. So just because you know somebody who really loves it or really hates it, it doesn't mean that it would be the same for you. You know, you should get lots of work experience and or work shadowing experience and try and see as many different sides of it as you can. Don't be afraid to ask all the questions that you want to ask. It's better that you ask them now than to ask them when you're already in the middle of your degree or at the end or when you've already started working. It's better to learn it all before you even jump into doing dentistry. Just try and find out about what people's days are like, when they're working as a dentist, what do they like about the job? What don't they like about it? Just sort of be curious, I guess. And nowadays with social media and everything being online, I think it's just easier for you to just reach out to people yourself and just ask them any questions that you might have. You probably have to do work experience in person, maybe not with COVID, but usually you have to do work experience in person. And sometimes, staff, they just might not have time for you to answer all the questions that you want to ask them. So if that's the case, it might be easier to just reach out to people online in different areas of dentistry and just ask them about their days or why they went into dentistry or why they chose that specialty. So, just keep in mind that every job has a good and a bad side. So try and find out, both sides of it before you kind of come to a decision. Otherwise, I think you might be in for a little bit of a surprise later. The other thing I would say is dentistry is a really long commitment. I mean, as a degree, as a job, it's quite a long commitment. You put a lot of time and effort and money into it. So before you commit to it fully, I don't think there's any harm in having multiple other career paths that you're kind of considering. There's no harm in, having other things on your mind and sort of doing more work experience or work shadowing in each area before you completely settle on one thing. I mean, you might find that dentistry is still the thing that you are really excited about. And if that's the case, then great, then clearly you're doing the right thing. I would also just say that, the degree and the job can be kind of intense at times. So, if you have the chance to take a year out after school or either because you just want to take a year out or maybe because you didn't get into dental school the first time and you have to take a year out, I would say just take it and enjoy it because you're never going to get that kind of free time ever again. So make the most of it. Travel, do whatever it is you want to do, explore lots of options in terms of careers, try new hobbies, just have fun with it. Honestly, 1 year doesn't make a difference. I know it seems like it might when all of your friends are going off to college, university, and you might feel like you're really going to be behind in comparison to them. But when you look back, you realize that 1 year actually makes no difference whatsoever, and it passes by so quickly. So yeah, just make the most of it. And in terms of picking a dental school, I would say that most of them are very similar. Only because, as dentists, you have to graduate to a certain standard. There's a certain standard of things that you have to know and you have to learn in order for them to allow, release you into the general public and let you treat people. So you're all roughly going to learn the same things no matter where you study. So I wouldn't worry too much about where you're going. I would base my decision on where I would be happiest spending the next 4 to 6 years of my life, because you're going to spend a lot of time there. So, where would I make the most friends? Where would I enjoy the social life the most? Where would you be happier spending all that time? So that's how I would pick a dental school. Speaking of dental school, let's talk more about that. So as I said, dental school is intense. It can be a bit stressful. There's a lot to learn in what feels like a really short period of time. It might be 4, 5, 6 years, but it goes really quickly. So because you have so much to learn and so much to do in that time, your student life won't be like that of other students. You know, normally when people think of student life, they're thinking days with lots of lions, you know, just going to 1 or 2 lectures, going back to bed, you know, sleeping at ridiculous hours. That doesn't really happen. Dentistry, you know, the dental school life is more like a 9 to 5, Monday to Friday kind of week. Is basically a full-time job, but without the pay. And the reason for that is that you have so much clinical practice that you need to get in before you graduate. And there's so much to learn that you want to, you know, get in all the practice that you can. So your days will really be packed with clinics and patients and lectures. So you're not going to have the same student life as your friends. So just, you know, just keep that in mind. I don't think that was something that I was it was something I had thought of when I started. So I kind of touched on this, but you know, might find it stressful at times. And it's not meant to be easy. Dental school is not meant to be easy. There's a lot to do in a short amount of time. So there might be points or many points where you find that it's just all a bit too much, but just try and keep in mind that all the other peers, all the other students that are in your year, they're finding it just as stressful as you are. You're not alone. And they might not say it, or it might not appear that way on the outside, but they definitely are. It's just that way for everybody. So it's important to kind of figure out a way to de-stress yourself. And, you know, this might be things like exercise or yoga, meditation, listening to music, going for a walk, you know, going out to see your friends, whatever it is that kind of calms you down. It's a good point in your life to learn that skill of how to de-stress, because it will really, really come in handy for later. You know, in terms of dental school, but also just your career. It will really, really help you to manage everything much better. The next thing I would say is that dental school can be really competitive. And the reason for that is, whilst you're really smart, obviously, because you got into dental school, everyone else on your course is equally as smart. It's a course full of really high achieving people. So it's only natural that things can become really competitive. But just try not to take that too personally. Try not to get too stressed about that side of it. Just focus, you know, on the end goal, which is learning as much as you can and just trying to get out the other end in one piece. And so you can start working as a dentist. Again, you might find like everyone is finding it easier than you, but trust me, with a little bit of practice, once you graduate, you all quickly get up to the same good standard in no time. So don't worry too much about that. The next thing I would say is that students tend to struggle with not feeling very confident. Even once they graduate and they come out of their degree, they still have that feeling of, you know, I'm not really sure, I don't really know everything, I'm not really that confident, and that's kind of a worry. And that's normal, you know, despite all the clinics and the lectures and all the years that you've spent studying, you can still feel a bit unprepared sometimes and not really be ready to be dropped into the wider world and let loose on all these people. And it's just partly because there's so much to learn in dental school, and when you graduate, you're only really mastering the basics. And so it can be a little daunting at first, but the confidence comes with practice. So the more you do, the more confident you'll feel. And it's just that way for everyone. It's been that way for all dentists. So that being said, whilst you're in dental school, just try and get as much practice as you can. You know, try lots of treatments, try new things if they let you, you know, if you have the chance to do something new. And it will feel really difficult and really scary because it's outside of your comfort zone. So that's normal. But it's better that you try them in dental school when you have, you know, your tutors and your teachers there to supervise you right next to you. Because once you're out of dental school and you're working as a dentist, you might not always have that level of support or somebody who's willing to be there right next to you and watch you do things. So make the most of that and sort of really take advantage of it. Yeah, the other thing I would say is about sort of being curious at dental school. It's a really good opportunity to ask people whatever you want to ask them. You know, you can ask your tutors about dental things like dental procedures and techniques, but you can also ask them about their career paths, you know, how they got to where they are, what made them choose their specialty. You know, they're there to share their knowledge with you, so don't feel stupid for asking them all these random questions, even if it's not specifically related to, the session or the clinic that you're having. And even outside of the dental department, there are so many other members of staff there that you can ask questions, from different departments, and you can build connections with them, because you never really know when that might come in handy for you. And after you leave dental school, it's much more difficult to connect and reach out to these people, which I don't think I realized when I was there, what a great opportunity that was. So, make all the connections you can, befriend all the staff that you can, because once you leave, it's much harder to make that kind of connection with these people. Okay, so that's all I wanted to say on dental school, pretty much. So advice about studying. So this is what kind of worked for me. Not that I'm a pro at studying or anything, but in terms of studying, I think the most important thing to remember is that everyone studies really differently, and what works for your friends might not really work for you. For me personally, I found that I could only really concentrate first thing in the morning, and then sort of afternoon time, my brain was just dead. I couldn't focus on anything. So it would have been a waste of time for me to try and revise in the evening, because nothing would go in. And things like the methods of study, like I enjoy learning with pictures and diagrams and through talking to people, and things go in much easier for me that way. Whereas other people, have a much more photographic memory, or they learn by writing things out repeatedly, but that doesn't really work for me. So the quicker you find your learning method, the easier it will be for you, and the less time you spend procrastinating and wasting time, which means that you have more time to do fun things or whatever else you want to do, because you don't want to spend all your time in the library. Nobody wants that. You want to get outside and have fun. So I think just finding a good learning method will make things much easier for you. And in terms of like what to learn, again, there's so much information that you'll come across. So I think, the best advice I can give you on that would just be to make sure that all the foundations are solid. So just make sure that the basic important things are just firmly ingrained in your mind. The rest you need to know really to pass exams, but it's not the end of the world if you forget it. Nobody remembers everything that they learn in dental school, nobody. So just try and get the basics down. And then once you graduate, you can always go back and refresh your knowledge. You can always go on courses. You can always read up. You can always fill in the little details that are missing here and there. But it's like the basic stuff that you need to know that you're going to do every day, day in, day out. The really important stuff, that's what you need to kind of focus in and try not to forget. Don't worry about everything else, all the extra, all these random diseases that you very rarely come across, because you just need those to pass exams. And if you need to learn it again later, that's not a problem. Yeah, the other thing I would say is that you should use your friends to help you. Remember that all of you guys are learning the same things in dental school. So study groups are really helpful, actually. Even if you don't learn anything, it kind of reminds you that everyone else is struggling to learn the same things that you are. So use that time to kind of discuss things with each other and find out what everyone else is having issues with. I find personally that I can remember things that other people tend to forget, and vice versa. So it's kind of nice to have that discussion. Plus, I think it just makes revision more fun when you're doing it in a study group with your friends. It's just less stressful. And if you're less stressed, then you're going to remember much more. So it kind of works out really well that way. The last thing I would say about studying is probably the most important thing is to make time for relaxation. If you're overdoing it or you're too stressed, you're going to find that it's really hard to concentrate, and actually revision isn't going to go well for you. You actually need to give yourself some time to process what you've been learning, which means actually taking a break or having a nap or whatever. So take some time each day to relax and have fun, and don't feel guilty for doing that. It's really important, because you'll be spending a lot of time in dental school doing exams and learning, and even after you graduate, that might continue. So it's really important to kind of learn to maintain a really healthy cycle of studying and relaxation and balancing things. And also sleep is really important. I would say don't neglect that. I'm not really a fan of people who do this last minute thing where they sort of camp out in the library for 3 days before finals. I know it works for some people and that's how they revise for every exam, but long term, I don't think that's like a sustainable way to study, and it's, you know, it's just going to wear you out, and you probably don't remember things as well. You know, after exams are finished, you probably don't remember a lot of that knowledge. So I would say, you know, it's a really good idea to learn how to balance studying and free time in your life, because you know, especially if you specialize, you're going to be studying for a very long time. So it's really important skill to learn. Okay. Okay, so this is just some general advice for people who have just sort of come out of dental school within their first couple of years. Again, I kind of touched on this before, but the confidence that you might feel like you're lacking at the beginning, it just comes with practice, and it's the same for everybody. Once you start working and you see lots and lots of patients, which you will in your even just in your first year, by the end of the year, you'll feel way more confident than you did at the beginning. So, you know, don't worry if even after you've graduated and you've left university and you're thinking, oh, I really don't feel confident in lots of procedures. Trust me, I was the same. It just comes with lots and lots of practice. So when people start looking for a practice to work in or a clinic to work in, I think for me, the most important thing that they should focus on is the team. People tend to look for practices which are really fancy, or they look nice, or they have nice equipment, or a really great reputation. But I think the team makes the difference. And by that, I mean having staff who are really supportive and really friendly. You need a team around you that can help you when you really need it. Encourage you, especially because, you know, you're just starting off, and a team that always makes you feel like you can ask for help. And it's not always that way in all the places that you work in. Not all the teams are as supportive or as friendly or as encouraging. So I think it's a big factor as to whether dentists are happy working somewhere or not, whether they get on with their team or not. It's great to have a team that lets you practice dentistry the way you want to. Sometimes they may kind of encourage you to practice dentistry the way that they think you should for whatever reason. And every clinician is different, and everyone has their own clinical judgment. So what you really want to look for is a clinic who has a team that's really supportive, but they also allow you clinical freedom, which means that you can practice dentistry the way that you want to, see patients the way that you want to, treatment plan them the way that you want to. That would be the ideal. And when you start working, despite all the years in dental school, you might feel like you have lots of gaps in your knowledge, or even, you know, practical things that you might not be sure about. Again, that's normal. And the simplest thing to do in that case is to ask one of the senior dentists in the clinic or the practice that you're working in to come and watch you do a procedure, or to, you know, just discuss a case maybe after work and get their advice, because what they have that you don't have is years of experience. And they've probably been in that same situation multiple times. So they can give you really good advice. So make the most of that and don't be afraid to ask them. Also, it's nice to just ask your fellow graduates from dental school, because they've probably come across a similar case. So it's nice to just ask them how they dealt with it if you're unsure, you're ever stuck. I think it's important to remember that when you graduate, you're actually really just a safe beginner. And you have a really long way to go and lots more to learn. And although dentistry is a niche, it's really not a small field at all. You can spend the rest of your life learning more about it. It's actually, there's a lot in there. So, you know, don't feel like you have to know everything just because you've come out of dental school, because you won't. Just some general advice about careers. You don't have to be a dentist full time. So when people graduate, that's the thing that they tend to do, just get, you know, a 5 to 6 day job and just work as many hours as they can. So, you know, your friends might be doing that, but unless you desperately need the money, you don't have to. You can do the job part-time. You can look around for a job that has hours that suit you. You can spend the rest of your time looking for other dental related jobs. You could do teaching or studying. You could do a job that's completely unrelated to dentistry. You know, in the days that you're off, nobody really said that you had to do dentistry 5 to 6 days a week, or even up until the time that you retire. It's really up to you. It's as flexible as you want it to be. I think that's something that took me a really long time to realize. Okay, so there's always that question that people ask about whether they should specialize or not. I would say generally just, start with general dentistry or being an associate. Try a bit of everything, because you won't really know what you'll like. Even going through dental school, you won't really know what you'll like. Often the things that we don't like are the things that we don't feel confident at. So the more practice you get with something, the more you'll start to like it. So you might find that the thing you hated at dental school is actually becoming your new favorite thing, because you've gained so much experience in it and you don't feel as nervous or worried about doing it anymore. So just don't write off any specialties. Just keep an open mind as you do your first couple of years of general dentistry. And then after a few years of practicing, you might find that you have a particular interest in one area. Then I would say, go and try and find some specialists in this area, reach out to them, again, go through the whole process of finding out what they like about it, what don't they like about it, what's their workload like, how many hours do they work, how much time did they have to spend studying and doing research or working in a clinic, how long is the specialty, how expensive is it, just go through all the questions, do your homework basically. And then doing some work shadowing would be a good idea. See if you can get them to let you sit in some procedures, or maybe follow them around for a few days, just so you can see what your days would end up looking like. You just want to figure out if this specialty is something that you want to invest more of your time and money and energy into, because you're going to be spending a lot of time focusing on this very specific area of dentistry. I didn't specialize. I'm a general dentist, and I think part of the reason that people don't specialize is either because they don't want to go back to school again and study further, which is fair enough. Dentistry is very long anyway, or they don't want to spend, or they don't have the money to spend on another qualification. Or it might be that they just enjoy doing a little bit of everything every day. They just like that variation from general dentistry. So it kind of just it depends on your preferences and what's going on in your life. That might guide your decision. If you're in dental school at the moment, if you're a student, I think it's really difficult for you to make that decision now, not having enough experience trying each specialty. So just keep an open mind, basically, is what I'm trying to say. Okay. So here is a typical day for me working as a general dentist. So I usually arrive at my clinic about 8 in the morning. Clinic starts 8:30. So I think it depends on each clinician and how they like to get things done. But personally, I myself like to set everything up and make sure everything is ready to go before the patient walks in. Usually that's done by the nurse, but I like to just make sure it's done the way that I like it. And, I do other things in the morning. So I come in, I turn everything on, set up the chair, get my instruments, and then I go through the list of my patients and all the treatments that they have to do. And I see what cases that I have, make sure any lab work that I needed was back from the lab. And if I have a difficult case or a difficult patient, I would make sure that I know what I'm doing, or I write down anything that I need to check or discuss with the patient. For example, if they didn't know what their medications were and I need them to tell me for this appointment, or we hadn't decided on a treatment plan and we needed to go over the discussion again, or maybe the patient has changed their mind and now I need to rediscuss things with them. There's lots of things that you might want to have to discuss with patients again in following appointments. So I just kind of make a note of that so I don't forget. So I like to start the day exactly on time, and I hate running late. When you're really busy and you have a really tightly packed schedule, you'll find that if you run late for one patient, you tend to run late for the rest of the day, and then it just runs into everything. Patients don't like it. I don't like it. Staff want to finish on time. They want to go for lunch on time. Nurses don't like it when you make them stay. And also I need time to do other things. Like I want to finish all my notes. prepare for the afternoon, go through the afternoon list. So for me, being on time makes such a difference. So at the end of the morning, the nurse will clean up everything and go off to lunch. I spend another 15 minutes or so going through all my notes, writing up everything, going through all the x-ray reports, doing all the referrals, just checking that everything's been done for the morning, then have a look at my afternoon, do the same thing, see what needs to be done, check if the lab work is back, make any notes that I need to discuss anything with the patient, so that when I come back in after lunch, I can just get started. I feel like the more prepared you are, or for me personally, the more prepared I am, the less stressed I'm going to be. There's just less chance for error, less chance for things to go wrong. And I'm quite forgetful too. So if I've done everything in advance, then I know I don't have to try and remember it for later. So then the afternoon goes pretty quickly. And again, at the end of the day, I might have to stay for 15 minutes or so to complete everything for the afternoon patients. I don't like leaving work for the next day. Some people do, but I hate doing that. And again, it's partly because I'll forget. But it's just nice to start each day afresh with new work rather than sort of have work piling up from day to day. And sometimes if it's a really busy day, I might end up working through lunchtime and I don't get a lunch break. And sometimes I end up staying at the end of the day and I end up going home quite late. So you might not end up working the hours that you've been specifically set. It depends on how busy you are. But then there are the days where I get to leave really early because I finished treatment early or a patient hasn't shown up. So it kind of balances out. It's not always being late and running into lunch. It's kind of a mix. So it balances in the end. So as I said, every profession has a good side and a bad side. Dentistry is no different. So, just to kind of give you an idea of what both sides are like, I'll just go through the pros and cons. So let's start with the side of dentistry that I like a little bit less. So I think the thing that can stress me out the most is when clinics are really busy or like overly busy. Again, it depends, what kind of clinic you work in and what treatments you provide as to how busy it is. But as a general dentist, I tended to be really busy. And if there was a day where I was running late or where I had an extra emergency patient thrown into my diary, that would kind of increase my stress levels. Unfortunately, there's not much that you can do about that other than having good stress management techniques, which is what I was talking about before. Trying your best to run on time or catching up time. And this is where good teamwork really comes in terms of being organized and them helping out. Some people love that dentistry can be really busy and sometimes it can be a bit unpredictable. You don't know what emergency patients are going to come in with when they walk through the door. It could be toothache, it could be a broken crown, it could be a tooth that needs to come out, it could be a facial swelling, and some people love that. But I personally like to know, what my day is going to look like, and I like to know what my patients are coming in for so that I can kind of plan ahead for that. So I'm not too much of a fan of it being really, really busy. In terms of patients, most people are really friendly and they're really grateful for treatment, but there are always going to be those who are a little bit rude or annoying, or they think that they know better than you because they read something online or somebody else has told them something. And I think every dentist can agree that those people make even simple treatment very difficult. I think, though, that problem is common to any job where you have to deal with people. So it's kind of unavoidable. And so it can make the job a little bit difficult or stressful at times, but it actually does get a little better with practice. Either you get better at knowing what to say to these patients or how to calm them down, or what they say just doesn't bother you as much. But when you first start and you come across these people, it can be really difficult, and it can kind of weigh on your mind a bit and kind of stress you out, and everybody struggles with that, which is normal. And everyone goes through that, but eventually it doesn't become as much of an issue for you. Keeping on the subject of patients, sometimes you can disagree with a patient for whatever reason, and the disagreements can kind of escalate where the patient feels the need to complain about you to the practice. And sometimes that can be resolved with just a discussion with the patient, and sometimes that's enough. But in, a minority of cases, sometimes it goes beyond that. And this is one of those stressful events that every dentist hopes never happens to them, but it sort of seems to be something that's increasingly common. And often in that case, the dentist really hasn't done anything wrong. It's kind of rare that the dentist has done something wrong. But I think it's the stress of having your work scrutinized and someone, going through your cases and all your patients that makes the dentist in that situation feel really tense going through the process. And sometimes the process can last for months or years. And that's where the stress comes from. It's not something that you really need to worry about as a student. It's not something that you'd experience, but just something to kind of keep in the back of your mind as you start to practice as a dentist. Aside from being, really ethical and competent and having really good communication skills with your patients and really good notes as well, there's not really much you can do to avoid those kind of complaints. It's just one of those things. I think it comes with the job, unfortunately. But yeah, I'm not a fan of ever having been in that position. Yeah, and on the same note of patients, I think the other reason that, one of the reasons that they have disagreements sometimes is that they might have realistic or unrealistic expectations, or they might not understand why you won't agree to do a treatment for them. And often the reason is because they're not suitable for the treatment, or it's not in their best interest. If a patient comes in and they want, aesthetic veneers done, but they need lots of teeth taking out and they need lots of, proper dental work done, lots of fillings and things like that. Sometimes they might not like that you said no to the thing that they wanted because they feel like they're paying you for a certain treatment. But, there's just that misunderstanding between what your clinical judgment is as the dentist and what the patient thinks that you should be doing for them. So when they don't understand this, there can be some friction between you and the patient. And the other thing is sometimes they don't understand that there's no guarantee on anything we do, or things don't always work as expected. But that's dentistry. It's not always that black and white. For example, if a patient comes in with a toothache and you have to do a filling for them, and the filling is a very deep filling, and later, that might cause even more symptoms for the patient. And now the patient is thinking that because of the filling that you did, that you've given them this even more severe pain than they had before, and now they're blaming you for this. But actually, the initial problem was that they had decay, which is why you have to do the filling in the first place. So I think it's just that difference in understanding of what the issue is. And that's when it's really important to discuss things with the patients properly and just make sure that they kind of really understand what you're talking about. But it's not always that easy to make them see, and it can cause a bit of stress between you both. But I think that's universal between some patients and dentists. I think that's just a universal patient-dentist problem. But it's only going to be in a minority of people. Most people are fine and they're very grateful and they're very happy to come and see you. But, you do get the occasional one who gives you a bit of trouble. The last thing I would say is sort of a lack of teamwork. Now, this isn't really a problem that I've experienced personally, but I know that it's quite a common problem from peers that I've heard them sort of say this to me. So if the team isn't quite right, for example, if your boss or your principal isn't treating you the way that you want them to, this can create a lot of problems. Sometimes they might interfere into your work. Tell you that you can't do certain treatments or can't use certain materials, or you need to use certain materials, or whatever, then that can cause a problem, because you should be allowed to just practice dentistry as you want to and use whatever you want to, and treatment plan as you want to. Or sometimes they might expect you to generate a certain amount of money or work per month for the practice, which can be tricky because you don't know what your patients are going to need and how much money that's going to generate and so on. Or sometimes the teamwork isn't there with your staff. If you're running late, for example, it's like ideal to have a team that will come and help, so that everyone in the clinic can leave on time at the end of the day. And that only works if everyone comes in and helps cleaning up and putting all the equipment in the decon room and doing all that kind of stuff. But if the teamwork isn't there and you don't feel like you have that support, then you might kind of feel like you're doing the job alone, which can make it feel a bit isolating and a little bit stressful at times. Okay, so that's the side of dentistry that I don't like as much, and this is the side of dentistry that I do like. So for me, what I enjoyed about general practice was being able to do a mix of treatments. I think it just makes the day more interesting and it breaks up the day. You know, rather than doing a very similar treatment all day long, you get to do a variety of things. And it also means that no 2 days are the same, which I think might feel the case in other jobs, but I think general dentistry is quite varied enough to keep it interesting. Also, for me personally, I had a really great team in the clinic that I worked in, and that made all the difference for me. I could always go and ask for help or advice whenever I had problems. You know, I could go to the other dentists in the practice and discuss a case with them. Or if I was running late, the rest of the team would pull together and pick up the slack so that everyone could, you know, get out on time. But even outside of dentistry, you know, we spent a lot of time together and we became very close friends, which I think is important because you spend a lot of time with these people, more time than you're going to spend with your family or your friends or anyone else. And you can end up becoming quite close to them on a personal level. I think if I had had a different team or I didn't feel as close to my team, I don't think I would have enjoyed the job quite as much. And in terms of being an associate, I think I really liked that kind of flexibility. It meant that I could change appointments as I wanted. I could manage my days. I had full clinical freedom to do whatever I wanted with my patients. I could take time off if I needed. If I didn't have patients, I could just leave. And that's partly because associates are self-employed. So I had that flexibility to kind of just do what I wanted. And it helped that I had the team that allowed me to do that and didn't impose too many restrictions on me. So I think the days that were the best days for me were when patients were happy and treatment went well and everything was successful. I think that's always a good feeling. And sometimes it's a really small thing that makes the patient really happy, like replacing an old anterior composite, you know, white filling, and the patient is so much happier because their smile just looks so much nicer. Or it might be getting them out of pain, which is a really quick way to make a patient really happier. I mean, you can imagine if they've been in pain for, you know, a week, and then after a half an hour appointment with you, they're suddenly feeling so much better, then they're going to be a lot happier, which is always a great feeling. So, you know, that satisfaction that you get from helping someone is probably one of the best parts of being a dentist in any specialty. And even after doing the job for a few years, I feel like I'm always learning new things. It's always nice to learn from others, you know, other members of staff or other peers, and see how everyone else does things. There are multiple ways to do the same thing and everyone has preferences. And the good thing about dentistry is there's always room to learn more and pick up new techniques and try new materials and upgrade your skills. It doesn't ever really get to the point where you think, I know everything there is to know about dentistry. You know, that day doesn't ever really come for anybody. Okay, so these are some things that I think I didn't know before I went to dental school, or even as a student, really. I think one of the biggest things that was a surprise to me, and maybe it was just that I was being a bit dense, but I didn't realize I'd have to talk to patients about money. That thought just didn't cross my mind, and it's partly because at dental school, we didn't ever have to do that. So the first time you have to do it is when you start working, and they don't really prepare you for that. So it was a bit awkward for me at first, and I didn't really feel comfortable telling my patients how much things cost, but you have to. And on top of that, I didn't realize that patients would choose treatment based on cost. Some patients didn't always want to have all their treatment done because of how expensive it was for them. And that was just a different side of dentistry for me. I mean, I had always assumed that my patients just trusted me And if I told them that they needed work doing, they would just come back and they would just be happy to pay for it. It didn't really cross my mind that they might not be able to afford the treatment, or they just might not want to pay, so they might only have half the work done. So this means that you end up practicing dentistry a little bit differently to how you thought you would, and you have different conversations with patients, and you can sometimes end up trying to do work that's just the necessary and urgent work for them because you know that you're never going to see them again. For example, and this was something that I had really commonly, patients that came in with dental pain and they really needed a root canal or an extraction. They needed to have a tooth out. So they might come to you as an urgent appointment. You've never seen this patient before. You tell them what they need. They need to come back for a root canal or an extraction. You dress the tooth, get them out of pain, and you never see them again. And, it's either the cost of the treatment, or they can't be bothered to come back, or they're not interested, they're not in pain anymore. So it's not important to them, but, you don't see those patients again. The other thing that I kind of didn't really realize anything about was the business side of dentistry. I know lots of people are interested in setting up their own clinics at some point. That wasn't something that I really wanted to do, partly because I'm not really into the business or financial side of dentistry. I have a hard enough time managing my own finances. So for those of you who might be thinking about it, it's not really something that you're going to learn in dental school. They don't really do business management classes or lectures about how to run a practice. It's something that you'll actually have to learn by talking to other people. And I think a lot of people struggle with that, and they kind of wish that they had been taught some of the basics at dental school, because you end up having to learn it all by yourself once you finish. But hopefully that might change at some point. They might start introducing that. And on the topic of patients, I think, I kind of mentioned this before, but I think I had this assumption that all patients would be nice and really grateful for treatment if I was nice to them. And most patients are. They're very nice and appreciative of what you do. But there are some that just really aren't, and it doesn't matter how nice and accommodating you are to them, or how great, your end root canal is or whatever. They just don't see that for whatever reason, and it can kind of be a bit disheartening, especially, if you're newly graduated and you feel like you've put all this time and effort in and you've gone the extra mile for this patient and they don't really care, or they're complaining because it's not what they thought it would be like or look like. And most of the time, it's not your fault. It's just because there's a lack of understanding on the patient side. Maybe they misunderstood what you told them, or they had heard something from someone else that said something differently, or read something which was different, and all of that is just confusing them. Either way, it's not usually your fault, so don't take it personally. And I think that was a really hard lesson for me to learn, and it took me a while to let situations like that go without, spending time worrying about them. The next thing I would say, again, I sort of mentioned this, is when choosing where to work, I think focusing in on the dental team is the most important factor. You're going to spend so much time with these people, especially your nurse, your assistant. When you have that really close bond with your assistant, the work flows really, really well. Your day goes so much more smoothly. And they will hand you things and set up things without you even having to ask for them. They can almost read your mind. It's actually pretty amazing, but it's because you spend so much time with this person. They know how you work, you know how they work, and you just have this really good synergy between you. So just focus on the team, I think. One of the other things is that you spend a lot of time, or maybe not a lot, but more time than I had realized, doing non-dental things than dental. And by that, I mean things like paperwork, referrals. I spent a lot of time writing really good notes, chasing things up, calling patients, calling the lab, checking on your targets, doing audits, like all this extra stuff, which isn't anything really to do with like treating your patients. That consumes quite a bit of your time, and it can be a bit annoying when you just want to spend your day talking to patients and treating them and then go home. But unfortunately, that's part of the job. And again, you don't really get much experience with all of that at dental school. but you will once you start working. So you'll see what I mean about having to do lots of other things. The last thing I would say is about sort of the business side of dentistry, in that when you train to be a dentist, you don't realize at first that dentistry is a business and the clinic or the practice is a business at the end of the day. So as a dentist, you're the person who's generating profit for that business. So, my advice would be, when you start working or picking a clinic that you work in, to find somewhere where patients and treatment are prioritized, and you have the freedom to work as you want to and treatment plan them as you see appropriate. If you're working in a place where they're kind of prioritizing profits or targets and things like that more so over the patients, you'll find it really difficult to practice good dentistry, and it's just going to stress you out. You're not going to do the dentistry that you were trained to do or do the best for your patients. So yeah, just something to keep in mind. There are people out there who see it as a business, not healthcare. So, you got to be careful with that one. Okay. Making mistakes. So as a student, there will definitely come a point where you'll make a mistake, at least one. I'm going to say you're going to make many, which is normal. And that's what dental school is for. That's where you learn and make mistakes. And even after you graduate, you're going to make mistakes too. I mean, you could be practicing for 30 years and you can still make mistakes. That's just dentistry. You can't possibly be perfect all the time. And also you can't learn everything that you need to know by reading it in a textbook. And, what's in a book is very different to doing something on a patient. Everything comes with practice and experience and making mistakes. So, you might do some stupid things in dental school, and you might have, if you're unlucky, one of those teachers who makes you feel really stupid for making a mistake. Don't take that criticism to heart, is what I would say about that. Honestly, they really shouldn't be teaching you that way, because it's not useful and it's not productive. But some people, don't ask me why, like to train students that way. And I guess they think that by making you feel bad that you won't make the mistake again. But I don't think that particularly works. But anyway, just don't take it too personally. Just know that everyone makes mistakes and that's normal. Your teachers and your professors were all students once, and I'm sure they did things that were far worse than what you've done. So don't worry about it. And also, making mistakes can be a good thing. So I feel like that's when you learn the most. You always remember, the cases where you've messed up or where you said something stupid to the patient. You never forget those, and it will make you never want to make that mistake again. So it is a good thing to make mistakes from time to time. And if you have a teacher that's really encouraging and supportive, then they can show you how to not make that error again and how to fix that mistake and how to learn from it. So one day you'll look back and laugh about the stupid thing that you did or said to that patient. So don't worry about making mistakes. We've all been there. Okay, so dealing with difficult patients. Again, I was talking about this before. Occasionally you're going to get the odd, tricky or difficult patient. It's unavoidable. From experience, don't get angry with the patient. It only makes things worse. The best way I found to deal with them is just to remain calm, stick to the facts, just try and focus on discussing what the issue is. Sometimes they just need to go home and calm down, and usually they're much better at the next appointment. And often if they're angry or upset, it's because they're very nervous and they don't understand what's going on. They're not sure what you're doing or what's going on, and that's what's stressing them out. So sometimes it's just a case of explaining something again to them, and that calms them down. If it gets to the point where you really can't work with this patient anymore, and every session is just becoming a disagreement, all you can do is suggest to them that they need to find a different dentist. It doesn't really happen often. It's very rare that it comes to this, but they may be the odd one or two people who for some reason are just always unhappy with whatever you do and you just can't get along with them. And in that case, it might be better to suggest to them to maybe go elsewhere if they're not happy. Okay, so I think this is my last slide. Just some general advice that I would kind of keep in the back of my mind. So I definitely think it's important to have a life outside of dentistry. And by that, I mean having friends and hobbies that have nothing to do with dentistry whatsoever. As I said, the job can come with its stresses, like every job. And it's important that you can spend some time away from it, completely away from it, doing things which have nothing to do with it. It will help you keep that balance in your life. Otherwise, it's really easy to spend your free time thinking about clinical cases. And, if you have lots of dentist friends, then you end up just talking about work and this patient and that patient, and it kind of feels like you never leave work. So make some time to make sure you take a regular break away. In the long term, it just makes it much easier for you, and it's easier for you to deal with stress. And it just means that when you go back to work the next day or on Monday, you're just sort of refreshed because you've actually had a break and you're ready to start again. I kind of mentioned this before, but preparation, either as a student or a dentist, knowing what's coming ahead, being prepared, doing all the necessary reading or preparation or whatever, helps to make things run so much smoother. In the end, it just means so much less stress for you and less panic and last minute, worry about what's going on. The worst days that I've had as a dentist or a student or when I've been unprepared for something. So just do your best to kind of prepare where you can. Obviously, it's not always possible, but where you can. Stress management, definitely important. Figure out how to manage your own stress. It's important for dentistry, but just in life generally. It's better that you start now while you're a student. It'll make it easier for you to develop a habit rather than getting to the middle of your dental career, 20 years in, and realize that you're actually a very stressed person, and you're on the verge of burning out because you're so tense, and you didn't notice before. It's much easier that you start before that even happens, or before you're even in that situation, and then it just becomes habit, and you just will find it easier to get to a calm place really quickly. Asking for help is probably one of the biggest things. I think people kind of have that feeling of, well, I'm a graduated dentist now, I shouldn't need to ask for help from anyone, which is rubbish. That's not true at all. Even dentists who've been practicing for years need help from time to time. There's nothing wrong with that. No dentist knows everything about dentistry. We all need to ask for advice from our colleagues from time to time. You might want someone to have another look at an x-ray just to double check that they're seeing what you're seeing, or check if this patient needs to be referred or not, or whatever. Like it's common to everyone. Everyone needs to ask for help from time to time, so don't feel like you can't do that. That's the best thing about having a really great team around you, full of colleagues who are experienced, and they've maybe come from different areas of dentistry. They can all give you different kinds of advice. So just don't be afraid to ask for help. Okay, the last thing I would say is doing things outside your regular job. So lots of dentists out there don't just do one job. They might work in their clinic for a few days. They might teach for a few days. They might do research. They might have a dental job which is non-clinical, like working in public health. They so they don't see patients in that job. They might even have a job which has nothing to do with dentistry. So there's lots of options out there. Don't feel like you have to do the same thing every day forever. Just keep your options open and just see what else is out there. And you can always change. You can always do one thing for a few years and then decide, oh, actually I want to go into teaching, or I want to go into public health, and whatever. But you can always sort of change things up. You don't have to stick to one thing for the rest of your career until you retire. And don't feel like you have to specialize either. It's really a choice. It sort of depends on your preference. Just try a few different things and see what you like. There's no rule with dentistry. There's no rule as to how you have to work in it. So just do whatever works for you, whatever makes you happy. Just go with that. So that's pretty much the end of my presentation. Thank you so much to the virtual dental shadowist team for allowing me to ramble on for an hour. And for anyone who logged on to listen today, I hope that was somewhat useful. And I don't know if anyone has any questions.
Yes, thank you so much for the presentation. It was amazing. We do have a couple of questions from our viewers. So the first one is it better to go to a school in the area you want to work as a dentist, or does the school location not matter?
Yeah, I mean, again, I live in England, but I really don't think that it matters at all. I think dentistry, doing a dental degree is different to say like doing a law degree where it kind of matters which school that you went to and that's what they're going to look at on your CV. Nobody really cares. Once you graduate and you have your VDS or your DDS or whatever, that's all they need to know. It doesn't matter where you went because you all learned the same things and you should all have the same standard of skills and knowledge. So yeah, I graduated somewhere and I worked somewhere else. So I didn't work and study in the same place. So it doesn't make a difference.
Okay, great. Another viewer has asked, what is the hardest thing about running a dental practice?
I mean, I don't run one, but I would say, from what I know, I would say probably like dealing with all the regulations, because that's the kind of thing that as dentists, like we don't really pay attention to. But there's a lot of like governing body regulations about what the staff should know, or like the safety of the equipment, or the materials need to be checked, and all that kind of paperwork stuff. I think is very time consuming, and it's just a lot of responsibility. You're responsible for all the staff and everything that happens within the practice, including paying everybody, and if something happens to the building, and yeah, there's a lot of factors in it. So it depends on your type of personality. If you love that kind of job where you're like organizing and managing things and running things, which some people love, but yeah, it's not something that I think I would ever consider.
Okay, that's great. The next one is also related to the previous question.
Yeah.
As a dentist, what should we look out for while looking for jobs?
Yeah, okay. So I kind of touched on this, but it's okay. It's hard to determine this when you go for an interview, but trying to figure out if you like the staff, even just on a like personal level, like are there people that you think that you would have fun talking to and spending time with? Because it's not all just about work, right? Like you want to build kind of friendships and relationships with these people. So if you think, oh, I'm not really going to like these people and I don't think I'll really get along with them, then I don't think you're really going to have much fun working there. And probably the commute, I guess. People get really miserable if they have a really long commute. So that's something to think about. I wouldn't worry too much about like what materials they have, or if they have like fancy equipment or things like that, because especially when you're starting, it doesn't really matter. You're kind of doing lots of basic dentistry. You need to get your basic skills right. So all the fancy equipment and fancy things that they have, you should be focusing on like the simple stuff like fillings and extractions and whatever. Like it doesn't matter about all the extra stuff. So I would just say the team, and if I was talking about clinical freedom before, so that basically means that nobody interferes with the way that you want to treat your patients, the way that you want to treatment plan them, because sometimes people do interfere and they kind of say, I want you to do more of these treatments because it's making us money, or I want you to use this material because we're promoting it, or whatever. So you don't want any of that. You don't want anyone interfering. So you should ask them if you have full clinical freedom when you start your job.
Mm-hmm. Yeah, absolutely correct. So the very, very last question is, what made you choose general dentistry over other specialties?
I mean, it's not, I wouldn't say it's a specialty, but I chose general dentistry because I like doing a mix of different things. I think I'd not say that I would get bored, but I think it's just nice having a variation. Sometimes, you have a very long root canal procedure and you just think, oh, I couldn't do another one of those right now. So it's nice to not have to do that again. And it's just nice to have a difference. It just breaks up the day, and I think it just makes it more interesting. You can't really get bored if you're doing different things every day. That, for me anyway, that's kind of how I feel.
Okay, thank you so much, Dr. Meera, for taking the time to talk to us about your profession. It's truly appreciated, and I know I learned a lot from your presentation. And to our viewers, for this session, our quiz will have 3 questions, and a 3 out of 3 will get you the credit score. As always, you will have the next 24 hours to submit the quiz. You can find the link in our Instagram bio. And to Dr. Meera, I want to thank you again for taking the time to talk to us, and everyone else, have a great day.